Hello, everyone, and good afternoon. I'm Stephen Grimaldi, the Executive Director of the New York Common Pantry. I want to welcome all of you for our fourth State of Hunger webinar. Today's session will focus on the latest Robinhood Poverty Tracker, which explores how New Yorkers experience poverty and material hardship over time, the types of hardships that people face and their impact, as well as policy and service solutions. I believe you'll find it extremely informative. At the end, we will discuss the New York Common Pantry, or how the New York Common Pantry is addressing some of these hardships for the communities we serve. We are pleased to be partnering with the Poverty Tracker creators, the Robinhood Foundation and Columbia University Center on Poverty and Social Policy and the Columbia Population Research Center. Before we begin, a bit of housekeeping. Please put any questions in the chat. We'll try to answer as many questions as possible during this webinar. We will send written answers after the webinar if we can't get to every question. I'm joined today by our special guest, Chymeka Olfonse, the Managing Director for Adults and Household Supports for Robinhood. She'll provide perspective on the organization's 35 years of working to lift New York City families out of poverty through grant making that supports community-based organizations and policy advocacy. We're also joined by Chris Wimer, the Director of Columbia University's Center on Poverty and Social Policy and the Principal Investigator on the Robinhood Poverty Tracker. We'll focus on the Poverty Tracker's recent results compared to past year's studies. You'll be hearing from Chymeka and Chris in a few minutes. To begin, I want to just share with you the mission of the New York Common Pantry. You'll see a lot of the work that we do ties into everything we're talking about today. We reduce hunger and promote dignity, health, and self-sufficiency. We can talk a little bit later about how we do that. Today, we're going to examine food hardship and our primary work that we do and other challenges that the communities that we serve are facing. As we know, it's extremely difficult to eat well on a limited budget. And currently, 1.7 million New Yorkers receive the Supplemental Nutrition Assistance Program, or what we call SNAP, formerly known as food stamps, and they receive those benefits on a monthly basis. In addition, there are about another 1.2 million New Yorkers that are considered unable to afford basic necessities. And the number of people coming to the doors of the New York Common Pantry continues to increase every single year, as many people are not able to afford or able to be eligible for those services, nor are they able to afford some basic things like clothing, transportation, food, of course, and housing. Now, according to the U.S. Census Bureau's latest poverty rates, poverty among children more than doubled, up to 12.4%. We'll talk a little bit about why that is during this presentation. More than half of New Yorkers earn less than $46,000 annually. That's 200% of the poverty line. But what it tells you is that there are many more people who need services, who need assistance. And there are many, many hardships that people face. And that's really the segue for today's discussion. The reasons why people are struggling are many. There's the high cost of food, childcare, and housing in New York City. For the people that we serve, the cost of food is extremely high. The price of fresh food is expensive for not only the individuals, but the grocers who provide food in those communities. It's difficult for people in our communities to afford all of the expenses, childcare and housing in particular, as I mentioned. Reduction in the pandemic era SNAP benefit was really challenging starting in March of last year. Other stimulus benefits as well. Those reductions, those enhancements have gone away. Changes in federal tax policies, including the expiration of the child care tax credit and the earned income tax credit. And of course, wages have just not kept up with inflation, especially in our city, where the cost of living is so high. So that sets the stage for what we're going to talk about today, which is food hardships and the many other hardships. And let me turn it now over to Chymeka, who will speak with you about Robinhood's work to alleviate poverty and the Poverty Tracker, and introduce Chris. Thank you.
Thanks so much, Stephen. I'm truly honored to be a part of today's very important conversation. I'll share a little bit more about Robinhood, our work in the food insecurity space, and then just give some context about like what's happening to set the stage, so building on what Stephen shared. So at Robinhood, we really want every New Yorker to be given a fair shot to succeed. As New York City's local largest poverty-fighting philanthropy, we want to fund organizations that help to elevate individuals and families out of poverty or ensure that they avoid it altogether, right? They remain stable. Each year, we distribute approximately $150 million in grants to more than 300 of the most impactful direct service community-based organizations across all the 5 boroughs. Our philanthropic approach uses investment principles with the goal of making smart bets to the most effective programs and organizations. Our grant-making strategy is multi-pronged, which for us includes fostering innovation, ensuring that we're investing in scaling in effective programs, funding data research to better understand the issues facing those in poverty. So that's why the work of the poverty tracker is really so critical, because all this data really informs our investments. And it also enables us to advocate for policies that really improve the lives of vulnerable New Yorkers. So in the food insecurity space, to really combat food insecurity, with about 1.7 million New Yorkers struggling to afford their next meal, as Stephen shared, we fund organizations that provide emergency food, yes, but they also enroll individuals and families in poverty-reducing benefits so they can secure wraparound services such as housing assistance or legal assistance referrals. It's a one-stop shop, and we're really grateful for that. Over our 35 years, we've been able to fund 82 million meals to feed hungry New Yorkers. In 2023, our emergency food partners distributed over 32 million pounds of food to around 340,000 New Yorkers facing food insecurity. That's significant, right? And we've been doing great work, and we're really grateful for our partners for really just lifting up the issues and addressing what's happening in our communities. And so really proud to be a partner to Common Pantry for over 30 plus years. We do support other organizations, leading emergency food providers who are serving New Yorkers in need across the 5 boroughs. I won't list them all, but they are on the screen and deserve their due recognition. I should also add that in addition to supporting partners directly, Robinhood also invests in improving the city's food ecosystem, which is extensive. We know we cannot fund every pantry. There are about 800 pantries in the city, and we can't invest in every single one. But we do want to ensure that the efforts of the emergency food system, there are sharing of best practices, the ecosystem operates efficiently and effectively. So we have partnered with the city, the Mayor's Office of Food Policy, to really think about the ecosystem. How do we make sure the food that is needed in communities is actually getting to those communities? And so we really have appreciated working with that office, but also with our providers to understand the issues and then also address them again to make the system more efficient and effective. And then let me just do more table setting. So the next slide, really thinking about and hopefully dispelling some myths about who are the individuals that are food insecure. First, context, New York City and the state's economy, it's relatively healthy, but the recovery after the pandemic has truly been uneven. We have employment levels back to around that of pre-pandemic levels, which is great, right? Like people have jobs. The state has considerable rainy day reserves in the billions, which is all great news. And, I think it's wonderful that our high wage earners got a boost in their wages, but unfortunately low wage workers hasn't. And what has really been driven in terms of job growth in the past year or so, primarily we've seen this growth in low wage sectors, such as home health care and social services, all very important fields, but the salaries and the hourly wages just don't keep up with inflation, and people are struggling. We think about the unemployment rate in the next slide. We know that New York City's unemployment rate is about 5.3%, but we have significant racial disparities. We have the unemployment rate for Blacks at 7.6% and 6.5% for Latinx individuals. And let's keep in mind that across the country, the unemployment rate is about 3.7%. So there is poverty, there's still hardship, there's still challenges. You have 55% more individuals receiving cash assistance in 2023 than they did in February 2020, right? Pandemic had just started, so that says a lot about what's happening. And, I don't care where you are on the spectrum in terms of your income, I think we all know, and Stephen said it, like the price of food has gone up. It's really high. So if we look at the next slide for the cost of food in general, like you're just seeing, not only did prices increase about 9% in 2022, they went up about 5.8% last year. They're going to go up again about 2.9% in 2024. But an increase is an increase, right? And I don't know about you, but in my local supermarket, the staples such as milk, eggs, and fresh produce are more expensive. And as a result, those of us who have jobs, we have sticker shock. But those who actually have less money have to make some very tough choices, whether it is to eat, whether it's go to the pantry and hopefully eat and be able to get some resources. Do I pay my rent? Do I actually pay a medical bill? Those are the challenges facing those who are food insecure. And the sad part is many of them are indeed working. So again, I just wanted to give you some context in which we're operating in, so we can understand the complexities of this issue. It's not just folks looking for a handout, they're actually trying to make ends meet and just to remain as stable as possible. So the last slide I'll just lift up is just to show you what Stephen shared about the fact that when we had the relief pandemic aid, you saw many New Yorkers not need temporary assistance. When they had the extra cash in hand, they were able to go about and not rely on certain services, but the roles did increase significantly once those pandemic era aid options ended. So again, just giving you the full picture. I'll now turn it over to Chris to share more about the poverty tracker and the work that is happening across the city.
Thank you. Thank you, Chymeka, and thank you, Stephen, for inviting us to be a part of this event today. I want to give you first a little bit of background about what the poverty tracker is, which is a study that we've been conducting in partnership with Robinhood for over 10 years now. It's a longitudinal study, which means that we're following the same households and the same people over time. And we are trying to understand aspects of obviously poverty, which is whether people have incomes that fall below a certain line or a certain level every year, but also going beyond poverty to look at other factors such as people's experiences of hardship or difficulties making ends meet, other forms of disadvantage such as health challenges, work limiting disabilities, for example, and then broader measures of people's well-being in many forms. As I said, it's a longitudinal, so we're checking in with the same New Yorkers across different cohorts in the study multiple times a year. Currently, we're interviewing people every 4 months. And because we have a large sample, we're following, 2,000 to 3,000 people at any given time. Every day, our team's in the field doing these surveys with New Yorkers from all walks of life. We have what's called a rotating cohort design. So this just means we're following specific cohorts that we recruited in different years, and we're following them from anywhere up to 4 to 6 years. And periodically, we're recruiting new New Yorkers into the sample in order to keep the survey representative of adults in New York City. So next slide, please. Today, we're going to focus on dynamics of food hardship in the city. We use the term food hardship in contrast to the word food insecurity, but it's really a very similar concept. We use the word food hardship mostly because we're tracking many different dimensions of material hardship. So, utility hardship, housing hardship, medical hardship, et cetera. But for our measure of food hardship, we distinguish between 2 levels, what we call severe food hardship and what we call moderate food hardship. And these are based on 2 survey questions that we ask our respondents in every survey or every year. And one is about how often they worry about food running out before they have money to buy more. And another is how often they actually run out of food before they have money to buy more. And so severe hardship is when people are reporting that that's happening to them often or routinely. And moderate food hardship is when that's happening a little bit less frequently. So when people say that they're sometimes running out of food. Next slide. And like I said, we're conducting these surveys every day with our team at Columbia. We have over 10 years of data at this point, and we're surveying people across all income levels, all races and ethnicities, all boroughs. And this just shows you a map of the food hardship rates across the city from a recent year in 2019. You can see there's quite a bit of variation across the city. In some areas of the city, the rates of food hardship are really quite high, including pockets of the Bronx and northern Manhattan and some areas in the other boroughs as well. Next slide. So here, this takes a bit of the long view back to 2016, including our most recent annual surveys, which capture people's experiences in 2022. And this shows the rates of food hardship overall in the city. The blue lines are for families with children, and the sort of yellow-greenish lines are among all adults in the city. You can see they basically follow similar patterns across the year. And I draw your attention to sort of two facts from this chart. One is if you look at the from 2019 to 2020, as the onset of the COVID-19 pandemic happened, we had a real spike in hardship, both severe and in overall hardship. So from 42% to 45% for overall hardship among families with children, for example, and 7 to 10% among the severe hardship among families with children. Both of those really fell in 2021. So the pandemic, of course, was still going on, still going strong in many parts of 2021. But what happened here is we had a really strong policy response to the COVID-19 pandemic and really historic levels of policy and income support to families, and especially families with children in the latter half of 2021, with things like the expanded child tax credit, which put a lot of income into the pockets of families with children who historically have been left out of that policy. So we actually saw food hardship decline really significantly, even though the pandemic's effects were still being felt quite widely across the city. In 2022, that reversed as some of those pandemic era supports expired. So for example, with severe food hardship among families with children, that dashed blue line at the bottom there, that rose back up from 6% to 10% in 2022 as those policy supports expired. Next slide. Like I said, we have these two items that constitute our food hardship measure, and this just zeroes in on one, which is people's direct reports that they're actually running out of food, not just worrying. Of course, that worry is a very significant form of food hardship. The stress and mental toll that takes on families is really important. But what this graph shows, and the reason I wanted to show this, is that those changes that I just highlighted from 2020 to 2021, and then this rebound in food hardship in 2022, is really driven by people's actually running out of food before they have money to buy more. So on the left hand, in terms of the moderate food hardship among adults, we see that moderate food hardship declined a lot in 2021 and then rebounded to higher levels in 2022. On the right-hand side, for families with children, we see that severe food hardship really dwindling down to just 2% in 2021 before bouncing right back up to 6% as those pandemic-era policy supports expired. Next slide. We actually ask people every year whether they visited a food pantry to get help with food, and this shows the rates of that, both for adults, that yellow line, as well as families with children, that blue line. And this really skyrocketed in the COVID-19 pandemic. So in all the years prior to the pandemic, we're seeing rates overall in the city of around 10%. That doubled to even tripled, depending on the population we're looking at in 2020. And that's come down in 2021 and 2022 as the economy has rebounded and as life is, it's still not quite back to normal, but as it's approached getting back to normal. But still, those levels of food pantry usage are not back to their pre-pandemic levels at all. Still very high rates of food pantry use in the city. Next slide. So the poverty tracker, like I said, we're following the same families every 4 months. And so we're constantly in the field doing our surveys. The child tax credit, which has been around for 25 years, which was created as sort of a credit to help families with the cost of raising children, has been expanded periodically over that 25-year period, but was really significantly expanded in response to the COVID-19 pandemic. Prior to the COVID-19 pandemic, about a third of children actually got nothing from the child tax credit at all because their earnings and incomes were too low to receive the full credit. But in the 2021, under expansion, both the credit levels increased a lot, up to $3,000 per child for older children and $3,600 for the year for younger children aged 0 to 5. But perhaps even more importantly, those children who were historically shut out or left behind from the full credit were made fully eligible in 2021. So people started receiving these monthly credits monthly payments from the child tax credit in the latter half of 2021. And we were interested to see if we saw any evidence of the impacts of those child tax credit payments in our data in the pandemic. So the slide that I'm showing now shows our causal estimates. So we're actually trying to understand whether people's receipt of these payments actually caused reductions in their material hardship and food hardship. And indeed, we see that's true. So I know the slide's a little bit complicated, but if you focus on those dark blue bars, that's showing the percent reduction in, if you look all the way on the right, for example, for food hardship, among families living in poverty, the receipt of those child tax credit payments reduced the experience of food hardship by almost 20%. It also reduced the experience of any hardship and also reduced the experience of people experiencing multiple hardships. So not just food hardship, but housing and bills, and these things can really rack up and accumulate, as I'll show you later. Next slide. We also looked at the effects of those child tax credit payments on pantry use. And we see, again, that there are these quite large effects of receiving these child tax credit payments on reduced utilization of food pantries. So often people would describe their experiences with these receiving these payments as giving them a bit more cushion and a bit more breath that they could take in order to meet their routine expenses. And as a result, we saw a less need for many families to have to rely on free food from food pantries. And as a result, from the earlier slide, also less experiences with food hardship. Next slide. In this year, every November around the time of Thanksgiving, we release a report with Robinhood that tries to put a spotlight on a different dimension of food hardship in the city. And in this year, we really asked the question, is food hardship an experience that New Yorkers are facing in isolation, or is it more commonly an experience that kind of co-occurs with other challenges in their life? So we look at both economic challenges, but then also non-economic challenges, particularly around people's health and well-being. So this first slide, which I'll show you, shows the experiences of other types of material hardship. And like I said, we look at housing hardship, utility hardships, medical hardships, and just general financial hardship, like how often people are living paycheck to paycheck. And fully 80%, so 4 in 5 adults in New York City who are experiencing that severe food hardship are also experiencing at least one of these other types of hardship. So that's a really staggering number. 4 out of 5 of those people who are struggling with food are not just struggling with food, they're struggling with along multiple dimensions. And over half of those people are struggling upon multiple other dimensions. Next slide. This shows what those other common struggles are that New Yorkers with food hardship are facing. If we just focus on these dark green bars, which are the New Yorkers who face severe hardship, nearly 2 in 3 were living paycheck to paycheck or often running out of money before they had their next paycheck or next infusion of income. Nearly 2 in 5 actually had a utility cutoff, not just falling behind on their utilities, but actually had a utility cut off. Nearly 20% or 1 in 5 experienced a real severe form of housing hardship, meaning they stay in a shelter or double up with other relatives because of the cost. And 2 out of 5 said that they weren't able to see a doctor when they needed to because of the cost. So this just shows that food hardship is not an experience that people face in isolation. People are coping with more widespread and pervasive economic insecurity. Next slide. We also look, like I said, beyond these sort of economic experiences and economic hardships, and here look at challenges with people's health and overall well-being. And again, we see 80% of those who are experiencing food hardship are struggling along one of these dimensions, these non-economic dimensions. And 60% of those who are just experiencing that moderate food hardship also were experiencing a health or well-being challenge. And I'll describe on the next slide what those are. So we looked at 3 forms. One is sort of this experience of health problems. So again, looking at these dark green bars, which are among New Yorkers experiencing severe hardship, half of those New Yorkers also reported a health problem, which meant they described their overall health as in poor condition, or they had a work-limiting health condition. Overall, on the right, we asked people about how well their life is going overall. Half of these New Yorkers who are experiencing severe food hardship also reported really low levels of life satisfaction. So really feeling like their life was not going according to plan. And 40% or 42% experienced what we call serious psychological distress, which means that people are reporting really frequent experiences of anxiety, depressive symptoms, worry, the kind of things that can be very stressful for New Yorkers' lives. Next slide. So I'm showing you a lot of numbers. Like I said, we're doing these surveys every 4 months with 2,000 to 3,000 New Yorkers. But we also try to periodically go and actually talk to the people who are participating in our survey and try to get a little bit deeper and get behind the numbers and understand people's stories. So in this latest report that came out in November, we highlighted one of these stories, a woman named Leticia, who's 49-year-old and was raising 2 teenage children. And we interviewed her a few months after those child tax credit payments shut off at the end of 2021. And she had been receiving those payments for her 2 children, which were about $250 a month for each child from July to December. And she really talked about the benefits of that child tax credit payments for both her and her family. She was able to use the money to expand her food budget and provide relief. She was one of the people who described these payments as just giving, it didn't solve all people's financial problems or completely eliminate all their food-related hardship or stress, but it really gave people a time to catch a breath. It was a phrase a lot of people used. And also, because it was cash, people used it for a lot of different purposes. So people would use it for school supplies in September, but might use it for Thanksgiving dinner in November or Christmas presents in December, for example. But when that CTC ended, her food insecurity returned, and this was a big struggle that Leticia described. She described how she couldn't afford school lunch money sometimes for her teenage children, meaning that sometimes those children actually had to go hungry during the school day. And that stress involved in that, she reported, was compounding some of her existing health challenges that she faced. So she reported, disruptions in her sleep and also challenges with her physical health. So one quote she said, "It's getting to the point where I don't sleep at night." So these experiences are not just these survey reports, they're really things that people are feeling and even sometimes are even getting under people's skin in terms of this real toxic stress that can take a toll on the body as well. So that's the end of my presentation. I'm happy to go into more detail in the Q&A, but I'm going to turn it back to Chymeka, and she's going to, I think, describe some of the potential policy responses that might be important.
Thanks so much, Chris. Appreciate that. Just sort of thinking about Leticia and other folks like that, really trying to lean into solutions at the moment that help New Yorkers remain stable. So at one point you hear family members say "Oh, we were able to get on our feet, catch a break." But at the same time, when any of that extra income had left, now they're struggling again, right? Which contributes to so many other issues that Chris raised when it comes to health or just being able to maintain and support your family. So we want to lean into things that allow folks, again, to stay stable and remain on their feet. So expanding the Empire State child tax credit, it's great that there was some improvements. Now children 0 to 4 are actually included in this tax credit, but we really want to make sure that we're removing the income phase-in requirement. So, families at all levels can qualify for this tax credit. You don't actually have to meet a particular income level. So again, we want families to be able to be supported in totality across the state. The other thing is, we all know that housing is really, really expensive in New York. There is a shortage, but at the same time, we know that folks are rent burdened. So really want to invest in housing vouchers through the Housing Voucher Access Program. We want to make sure that more dollars are in that space so that individuals don't have to spend upwards of 50% of their income on rent. They can use those dollars to be able to buy food, pay for bills, light bills or medical bills, et cetera. And the other thing I just want to highlight is the importance of high quality jobs, right? This is something that Robinhood has really stood and really said, you know what, we want to invest in this work. We were one of the largest private funder workforce development funders. And that's important to us because we want individuals to get into jobs where they are actually having a family sustaining wage. I don't know about you, but a lot of my friends who had children left New York because it was too expensive. They had okay jobs or they had good jobs, but it wasn't enough to be able to sustain their family. So we want to make sure that we continue to invest in programs that allow people to get into high quality jobs so they too can earn that boost and have that great wage. So we're always evaluating, again, programming, policy supports the work from the poverty tracker, informs what we want to do, and really think through the solutions that would have the most impact for the city and again, the most vulnerable New Yorkers. I think we have time for questions now. Is that right, Stephen?
Yes, but not before I just give a brief overview. First of all, Chris and Chymeka, thank you so much for coming, spending your time talking about this issue of food hardships and all the different types of hardships, because I do think this work, this study has informed our work, continues to inform our work, helps us understand where we need to improve our services. And also, and I think it was said quite well by both of our guests, policy matters. It's a perfect example when you look at the difference between 2021 and 2022. We saw it here, a rise, 32% increase in the number of individuals served. The year before, 5%. So we're always expecting that more people will come because of, as I mentioned, those other factors. But when you have a crisis like this and you have a policy response that lowers, the demand, and then you take that away and you see what the impact has been. So our programs are directed, purposeful, and responsive. Letitia is a perfect example of an individual who was helped by this, and many of the people that come here are helped. We have a choice pantry program, which provides groceries, free groceries. We have a mobile pantry program which understands the transportation costs and what it costs to come to a brick and mortar facility, just like all transportation costs for people who live in low-income communities. It's important to have the food in the community that you live in. So we have 180 sites across our 2 mobile programs, Nourish and Mobile Pantry Program. And then we talked about some of the other stressors, and Chris was identifying some of the health needs and the psychological stressors, the worry, the health and the mental health, the well-being part of it. Live Healthy is really an important part of our service portfolio, helping people understand how to prepare fresh, healthy food. We work with medical facilities, clinics, to make sure that fruit and vegetable prescriptions, doctors write those prescriptions, and we work with those individuals who are referred to our program to get those pantry packages, to get that fresh food, and to make sure that we have this service relationship with the clinic and the individual, the patient, our participant, to make sure they get the services they need and they're able to eat healthier and live healthier lives, because food-related chronic disease is a real issue. And again, it gets back to the physical health hardships that we discussed. In addition, of course, we have services for the homeless, because we do want people on the street to get to shelter, but we want people that are in shelter to get to permanent housing. So that is the policy relationship and the connection here. And what we do is connect people to housing vouchers, but also supported and affordable housing across our city. And finally, it's those benefits that we talked about that make such a huge difference, allowing people to apply for those SNAP benefits, helping people understand how the tax credits work, make them aware, and facilitate that through our Help 365 program. Last year, it brought in $7.1 million in resources other than food for the people we served. And finally, for our housing, for our homeless population, in addition to making sure they get the housing, we get them those other services like showers, haircuts, laundry, allow them to use us as a mailing address. Last year, we served over 10.1 million meals in addition to those other services, and we continue to see the number of people needing our services on the rise, and we'll continue to do that. But again, policy matters. And so we ask our participants, we ask those folks who are here today on the webinars, our supporters, our donors, our volunteers, our staff, to be aware of what those policy implications are, because they do matter to the people that we serve. So we do have some time for Q&A, and I want to make sure I get to some of the early questions that came in. Chris, this one's for you. In looking at the data, what would you say was the biggest surprise, if any, to you?
Yeah, I mean, honestly, I think the results were about what I expected, and I say that kind of unfortunately, because earlier I think we were surprised at the extent of some of the food hardship reductions and other reductions in hardship. It wasn't shocking because we knew there was a big, robust policy response to the pandemic, but you might have thought that the sort of economic devastation of the pandemic, as well as the sort of health consequences that people were grappling with, might have overwhelmed some of the policy response. But that policy we saw really did make a big difference. And then, we knew that a lot of those policy supports had gone away in 2022. And so we were expecting those hardship rates and poverty rates to rebound in 2022. And, in fact, they did. So we were, unfortunately not so surprised about that. But
another question was, were the participants in the study working? And how, and to what degree, what percentage were working, if you know that?
Yeah, so I'd say around 3 out of 4 of the respondents who had visited a pantry in the past 12 months were currently working at the time, or sorry, currently working or had been working in recent months, either themselves or their spouse or their partner. So work was very common among pantry recipients. We don't collect data on whether people are working every specific month. So, it's possible people were visiting a pantry in like a lot of people, I think, will go to a pantry in a period of economic crisis or after a job loss. But it was very common for people to be working even as they were utilizing the pantry. And I think that was one of the things that was especially true during the pandemic. I think it became, sometimes I think people view pantries as sort of an emergency, something they like an emergency provider. But I think in the pantry, when so many people were struggling with loss of employment, loss of income, we found in the poverty tracker roughly half of adults in New York experienced some loss of work or income in the pandemic. That probably helped explain some of the really dramatic rise in pantry use. And as we see, that hasn't fallen back to those pre-pandemic levels as much. So a lot of people are relying on that as part of their patchwork of how they make ends meet in the city. But yeah, these are not people who are not working. People are balancing work, raising kids, trying to provide food for their families. And so it's a critical lifeline for a lot of people.
Chymeka, I'm sure it's not a surprise to you at Robinhood that these people are the working poor.
Definitely not a surprise at all. And I think that's what I was trying to reiterate. Like, people need to understand there are jobs that exist in New York City. The challenge is, again, are you going to be able to have and be in high wage jobs? Let's just say you're an individual who is from a low income community. You may not have the resources, and we want to make sure you have access to good training so you can actually be eligible, right? There's low barriers to entries in certain sectors, and we want to make sure we're getting people into good jobs. And at the same time, we want to make sure that policy recommendations are such that we're able to give people some of the supports that they need so they can maintain that stability and not fall into poverty. Right? If you have a $400 expense, most people can't even afford that, right? One missed check or living paycheck to paycheck can severely impact an individual.
Great. I'm glad you highlighted the home health aides and the home care attendants, because many of those individuals really struggle to make ends meet. They work very hard. They work very long hours, and they just do not get paid very well. Finally, and I know someone, in addition, a couple of questions came in and talked about the policy recommendations, and I think we hit on many of those during the presentation. But this is for you, Chymeka, at Robinhood. How does the poverty tracker impact or influence your grants and some of the policy advocacy? You talked about some of that today. Do you feel as though some of this has changed the way that Robinhood has changed their advocacy for certain policies?
I would say it informs our work all the time, right? We really want to understand how, to Chris's presentation, not just food insecurity or food hardship, but just what else is happening in the space. So, for example, if we know that folks are rent burdened, we know then maybe we need to actually lean in on the housing front, right? Like, what are the policies we need to ensure that there's more affordability, but then also just more of a supply of housing? When we know folks are facing medical debt, and there are challenges there, what can we be doing to advocate to make sure that medical debt is eliminated, so people don't have those stressors? So to me, the poverty tracker gives us a good picture of what else is happening, not just, oh, there's poverty, but then what are the complexities that meet this poverty, and what are the impacts of having just such poverty, and then decisions that people need to make as a result, and then again, what policies that we can actually implement or advocate for to be implemented at the city and state level.
Thank you. I think, well, I'm just going to conclude by saying a few words, and I do want to mention that we will have the opportunity to send answers to anyone who may have asked a question that we were not able to get to. First of all, Chris and Chymeka, thank you again for coming, for telling this story. It is very important. I found it very informative. I know some of the comments are just love the data-rich, evidence-based research, which really has to inform our work. It has to be coupled with those qualitative stories too about people's experiences. That's what I love about this study and the longitudinal nature of it, where we look at people over time. I think it absolutely matters because poverty isn't always a temporary thing. It happens over many years. It has multiple impacts, and those hardships, they do accumulate, and they are painful. And we want to make sure we're doing whatever we can on the policy side and the service side to make sure we are making a difference. At the New York Common Pantry, we continue to look at new ways. We know that we need to get our services out in those communities. That's why we've expanded our mobile operations. We have a new hub, 23,000 square feet, which gets us to allows us to receive and distribute and get food out into the communities across our city, those communities that are hardest hit. And we continue to secure resources so we can have facility upgrades and we can utilize the vessel that we have in this hub to do more. We estimate we can double the amount of meals that we serve and the resources and the services that go along with those meals with the right amount of resources because we have that facility. So how can you help? First of all, continue to spread the word, continue to learn about these issues, whether that be going to Robinhood's website, whether that be coming to the New York Common Pantry's website, spread the word, tell people about the issues of food insecurity, mention how we assist those in need. Come to volunteer at an emergency feeding program, come to volunteer at the New York Common Pantry and see us in action and help make a difference, and bring a friend. Consider making a donation. So much of what we do is supported by the public. We need public support to do what we do. And finally, you can start a drive. You can start small. You can work with your faith-based organization, your school, your building, and your workplace to make sure that you're helping spread the word that there are people in need. And oftentimes that tangible connection really does make a difference. I want to thank you all for coming today. We're right on time. We appreciate you all. And again, thanks to Chymeka and Chris for your time today.
Thank you.
Thank you. Bye now.